Liver disease and diabetes. The hidden risk of liver disease from diabetes. When you have type 2 diabetes, it's important to monitor your liver for a condition. More and more research is showing that non-alcoholic fatty liver disease, NAFLD, is a condition that poses a risk of harm to your health. Non-alcoholic fatty liver disease, NAFLD, is especially common in people who are obese or have type 2 diabetes, or both. In addition, non-alcoholic fatty liver disease, NAFLD, may play a role in the development of prediabetes and type 2 diabetes. One of the liver's many jobs is regulating blood sugar. However, fat in the liver makes that organ less responsive to insulin. To greater than leaves too much glucose in the blood, which can lead to type 2 diabetes. On the other hand, having type 2 diabetes raises your odds of having a more severe form of non-alcoholic fatty liver disease, NAFLD. To greater than it is non-alcoholic steatohepatitis, NASH. In this case, liver fat triggers harmful inflammation that creates scar tissue there. This can lead over time to cirrhosis and end-stage liver disease. Of course, many people who have non-alcoholic fatty liver disease, NAFLD, or non-alcoholic steatohepatitis, NASH, don't know it. Liver disease and diabetes, information is especially important. About 3 in 4 patients with type 2 diabetes or prediabetes have too much fat in their liver. And about half of them have this inflammation and scarring, but in many cases they're unaware of it. Unfortunately, non-alcoholic fatty liver disease, NAFLD, has few symptoms, making it tough to diagnose. Some people feel pain in the upper right part of the abdomen, just below the rib cage. Sometimes blood work will show an unexplained spike in liver enzymes that prompts the doctor to take a closer look. Or patients might have a scan for another problem that shows there's too much fat in the liver. A new type of ultrasound used by liver specialists can estimate the fat content of the liver. At the same time, check liver tissue for stiffness, a sign of scarring. Liver disease and diabetes. Other information: if non-alcoholic fatty liver disease, NAFLD, and non-alcoholic steatohepatitis, NASH, detect it early, you can stop. And in some cases reverse them, mainly through weight loss. Studies show that losing 10% of your body weight can halt non-alcoholic fatty liver disease, NAFLD, and non-alcoholic steatohepatitis, NASH. But losing at least 7% is beneficial, and weight loss surgery, weight loss, may be one way to do it. A study that showed that an inexpensive type 2 diabetes drug, pioglitazone, reverses non-alcoholic steatohepatitis, NASH, in some cases. However, more research on new drugs is needed for this purpose. In particular, people who have type 2 diabetes talk with their doctors about liver disease. Unfortunately, there is a lack of awareness among doctors and their patients, and very little is being done to treat the disease. Given the dangers of cirrhosis and end-stage liver disease, there's a real urgency to identify patients who have this problem and consider treatment with lifestyle changes and medications. Liver disease and diabetes. Ask your doctor. Are my liver enzymes elevated? If the blood test shows that your liver enzymes are above 30 U/L to greater than, ask your doctor to consider that you may have non-alcoholic fatty liver disease, NAFLD. Also, other possible causes of elevated liver enzymes include alcohol abuse, hepatitis B, hepatitis C, and medications. Is there fat on my liver? Anytime you have an ultrasound or other imaging technique, if there's fat in the liver, that should be a huge red flag. Many times, doctors are not doing anything about it, but they should. Can you check me for fatty liver disease? Some hospitals now have a specialized ultrasound device called a FibroScan, which can check for evidence of liver disease, including fat on the liver. Can you help me reach a healthy weight? Losing weight is the best way to halt non-alcoholic fatty liver disease, NAFLD, and its more aggressive form, non-alcoholic steatohepatitis, NASH. Your doctor may refer you to a registered dietitian and support groups to aid your weight loss journey. Obtaining detailed information will contribute to better support for the treatment and prevention of diabetic liver disease. There is also a lot of information to discuss with your doctor. It will help you heal faster. Thank you. I hope you are always happy and healthy. Thanks for watching. Don't forget to subscribe to the channel to receive useful information.